Welcome to CARES, Cancer Rehab, Ed, and Support. Today, let's explore the science behind diet and cancer care, and what practical steps we can actually recommend. A gap between interest and guidance. Many cancer patients ask, what should I eat? Or, does diet really matter during or after cancer treatment? Yet the answers they often receive are vague, just eat a balanced diet. But what is a balanced diet? And why don't more doctors give detailed advice? The truth is, although many studies suggest a strong link between diet and cancer risk, specific guidelines for cancer patients are still lacking. This leaves patients confused and sometimes turning to unreliable sources. Official guidelines versus real-world adherence. Let's look at what the current official dietary guidelines recommend. Fruits, 1.5 to 2 cups per day. Vegetables, 2 to 3 cups per day. Fiber, 25 to 35 grams per day. But here's the problem. Only 12% of Americans meet the fruit goal. Just 10% meet the vegetable recommendation. And fewer than 5% consume enough fiber. Among cancer survivors, these numbers are just as low. What the studies actually show. There is growing evidence that dietary changes can influence outcomes in cancer care. Here are just a few examples. In patients with Lynch syndrome, resistant starch lowered the risk of non-colorectal cancers. In breast cancer patients undergoing chemotherapy, those who combined a plant-based diet and home exercise had a better treatment response. In multiple myeloma, patients with a healthier gut microbiome were more likely to stay in remission longer. And in stage 3 colon cancer, high adherence to cancer nutrition guidelines was linked to longer survival. These results don't mean food is a cure, but they do show diet can enhance overall health and even treatment outcomes. Gut microbiome, a key mediator. How does food influence cancer? One key pathway is through the gut microbiome. When patients eat a diverse, plant-rich diet, their microbiome becomes more diverse and stable. This microbial diversity is increasingly linked to better immune function and cancer outcomes. Simple steps like eating at least 30 different plant types per week or incorporating fermented foods can boost this diversity. Takeaway messages. So, what can we actually tell our patients? Instead of vague advice, give clear, actionable suggestions. Eat at least 25 g of fiber daily. Include at least 2 servings of fruit and 3 servings of vegetables. Limit sugary drinks and processed foods. Consider a referral to a registered dietitian. These changes don't just support your health, they also help the planet. This has been another episode from CARES, where science meets everyday survivorship. Don't forget to subscribe for more science-backed cancer care tips. See you in the next video.